Welcome to Mythbusters Down Syndrome Edition. My name is Aaron Waddingham.
Hi, my name is Dr. Kathryn Garforth from Garforth Education.
Hi, my name is Eleanor Stewart, and I'm from the Down Syndrome Resource Foundation. I'm the Director of Education and Services. And we're here to dispel some myths about Down syndrome.
People with Down syndrome are overweight.
You call me fat. I need to eat some healthy foods and work out. Enjoy yourself. More abject than around you. Just do things with some weights all day long. For me, I just work out on my abs because I would be Dwayne Johnson, The Rock, right?
So yeah, weight is a common issue for individuals with Down syndrome because again, it's related. Again, could be several factors there, but it's related to their low muscle tone. It's related to thyroid levels, which can, if those are off, that could cause you to have an increase in weight. It can also, related to diet and lifestyle. And, we've worked with several individuals where diet is, and your levels of satiation, right? So I think sometimes certain individuals with Down syndrome don't have that sense of feeling full or knowing when to, and again, this goes back to executive functioning too, knowing when to, inhibit yourself from eating too much or to stop, that kind of impulse control. And what we see now though, because we know these things about individuals with Down syndrome, now we are really focused on incorporating and planning the lifestyle. So making sure there's lots of physical activity and watching the diet and thinking about what needs to be included in that diet, and teaching strategies around healthy eating and healthy choices. And that's been really effective. And you see, there's several really skilled athletes that we have who are really fit individuals too, because there's several examples of special Olympians. And, there was just in the news that young man who just completed the Ironman had Down syndrome, right?
That was so cool.
Yeah.
And the other thing that it's just a matter of education. I mean, I think that's what a lot of this stuff boils down to, is that either the general population isn't having the information that they need to understand individuals with Down syndrome, and we're preventing the individual with Down syndrome from getting the information that they need to know about healthy eating and exercise. There are some things that neurotypical individuals are going to pick up naturally just from exposure and being in the situation. But we need to be conscious that our individuals with Down syndrome may need that more explicit approach and repeated approach, saying, this is what a healthy meal is. These are the food groups. We don't want to eat this type of food or very much of this type of food because it's not healthy and it makes us feel like this.
Yeah.
It's hard for our body to digest it, and that's how we control our weight. And talking about the importance of exercise and realizing that because of the low muscle tone, exercise is hard work and it's difficult. And so you need to try and find an activity that's enjoyable and that they are intrinsically motivated to do, right? Yeah. Something that they enjoy. Instead of making them do something that they hate, they're not going to do it. And they're not going to want to do it, right? They're human.
Yeah, exactly.